This involves a whole comprehensive program. This is way more than just doing the surgery. So when our patients come to us, it takes several months for them to go through the system of education and medical workup in preparation for surgery. One of the important things that I do with my patients is I try to look for every single category of risk that my patient might have. And by doing tests, we try to lower their risk in every single category before they come to surgery, so they don't have a problem when they get on the operating room table. I think that's why we have some of the best results in the country, not only in terms of outcomes of weight loss and cure of some of these metabolic diseases associated with that, but also in terms of the lowest number of complications that they can have from surgery.
And if it's something you decide to do, there are certain requirements that you have to meet, whether they're insurance-wise or whether it's just procedural-wise that you have to meet. Some of those things are having to do with fit tests. Are you even fit to actually have the procedure done? You have psychological evals you have to meet. You have to meet with a nutritionist, get a good idea of your consumption of food, portions, healthy eating, and you have to follow that guideline.
We have small group nutrition classes so that patients learn exactly how their diet progression is going to be after surgery, starting off on liquids and moving up to thicker and thicker food until they eat again normally. They eat small portions, but a whole range of normal food. If you went to a restaurant, you would never know that somebody had had one of these operations.
My name is Crystal Kwan. I'm an outpatient dietitian here at Huntington Hospital. As dietitians in the field, we help you to understand that bariatric surgery is a tool, and we help you to use that tool effectively. Specifically, that means following the dietary guidelines, using evidence-based recommendations, how to use those dietary recommendations so that you're losing weight and keeping it off in the long term, avoiding malnutrition and sickness, and feeling good in the process. Having nutrition services, whether in the class form or one-on-one sessions prior to surgery, is critically important to your overall success. That means you're not only just losing the weight that you're wanting to lose, but you're keeping it off and you're staying healthy in the process. You're feeling good, you're not getting sick, you're not putting yourself at risk for malnutrition. And this really sets you apart from other people who may assume that once you get the surgery, everything is great and you're done.
What our patients can expect as soon as they come to us from the recovery room is that the nursing staff will ensure that they are stable, that they are safe, and that they are comfortable. Those are really our main priorities that first day.
My name is Ann Lee. I'm clinical dietitian covering for the surgical unit. I do see patients after the bariatric surgery. I visit each patient after the surgery and ensure patient attended pre-op nutrition sessions with a dietitian and ensure patient has written diet guidelines.
What you eat after surgery is important because getting bariatric surgery has lifelong implications on your nutritional needs. This may determine what macronutrient profile you're going to need to follow, which vitamin and mineral supplements you'll need to consume and from which source, and what and how much to eat and drink. We work with you to help you understand what exact foods you need to eat, when and how much, and in what time period. And all of this to ensure that you're not sick and in fact thriving so that you're healthy and losing weight in the long term through the process of recovery and beyond.
The ease of the transition home from the hospital really has to do with making sure that the patient feels comfortable to go home. We, as the team, make sure that it's always a safe discharge home. Resources available to bariatric patients after they return home include bariatric support group, the nurse navigator calling them weekly for several weeks and then monthly for typically 3 months. And if there's specific needs that the patient has, then I work with them to help find whatever resources they need.
I think the most important thing for our bariatric patients to know prior to going home from the hospital is who to call if you need to reach out to somebody. There may be many questions after you go home, or even some issues, and you need to have knowledge of who the best person is to call. And most of the time that will be your surgeon, but there are many other resources available to you too. So it's really important to know that you are not alone. You are still in this journey along with all of us, and that we will make sure that you have the resources you need when you go home.
A nurse navigator working with the patient for several months after surgery is helpful because patients meet certain milestones throughout their recovery. As I tell patients, it's a marathon, not a sprint. So they will meet certain milestones, and then we reset goals. So it's about goal setting and support and motivation.
I committed myself to following that plan and not try to go too fast, not try to overdo it, and stick to that plan. And it's really worked for me, and it's really changed my overall health, plus my lifestyle. It changed it. It changed the way I thought about things personally, professionally, and definitely health-wise.